Greetings. Today is March 31st, and this is your daily COVID-19 update. As mentioned previously, the President has extended the social distancing order through the end of April, so all of the policies and procedures that we have implemented have also been extended for that time. The greatest risk to the community remains exposure from someone bringing the virus onto the campus from outside, either by our travel away from the village or from someone coming to visit or work who has been exposed to the virus. Therefore, I reiterate what we have shared before. Please limit your travel, even to stores in Live Oak, and also please limit visits from anyone, including family. If you must have contact with people outside of ACV, please follow these directives. If you must have a visit, make sure that the family member does not have any of the symptoms that would cause us to not allow them on campus. If visiting, they must be screened and issued a visitor pass at the information center. Questions that will be asked include: do you have a cough, shortness of breath, any other symptoms of respiratory infection? Do you have a fever greater than 100? Have you knowingly been in contact with someone who is under investigation for COVID-19 or has COVID-19? Within the last 14 days, have you participated in either of the following: travel on a cruise ship, travel by airplane, domestic or international, and if so, we'll ask for travel dates and itinerary. Have you visited an area within the state or local government that have issued stay-at-home orders due to COVID-19. Those include California, New York, New Jersey, Connecticut, Louisiana, and South Florida, including the counties of Miami-Dade, Broward, and Palm Beach. And if so, when and where? For members that are hospitalized, the village will require that the discharging hospital complete a hospital to post-acute care facility transport for COVID-19 assessment. Prior to discharge, and if indicated, we may require that you be tested prior to your return to the village. As mentioned, travel off campus is a high risk and is strongly discouraged. Current Florida Department of Health reporting shows that 88% of deaths from the virus are individuals that are above the age of 65. If you travel off campus overnight, you must be screened by your service coordinator prior to returning to campus, and once you arrive back, you must be screened at the information center and have your temperature taken prior to returning to your residence. For members who must receive critical supplies from family and live in Dowling House, Carter House, Smith Review Apartments, or Lawrence House, we ask that you meet your family outside the door and that your family not enter the facility unless authorized in advance by your service coordinator. Remember, all visitors on campus must be screened at the information center prior to going to any campus residence. There continues to be 3 Suwannee County residents who have tested positive for COVID-19. The virus is getting closer to Dowling Park, so I strongly urge you to continue to follow the guidelines that have been put in place at the recommendation of the CDC and federal and state health officials. Please know that the staff is as concerned as you are and working hard to ensure your safety. Please cooperate, and if you have a chance, thank the ones you come in contact with, and as you pray for the safety of this community, lift them up in your prayers as well. Many are dealing with personal issues as well as children being out of school and the challenges that all of this creates for each of us. As always, for information pertaining to your personal situation, please contact your service coordinator. Thank you.